Did you know that 32% of men using Tadalafil experience side effects they weren't warned about? And here's what's even more alarming. One of these effects can be a sign of something far more serious happening in your body. Tadalafil has revolutionized the treatment of erectile dysfunction since 2003, helping millions of men worldwide regain confidence and improve their quality of life. But like any medication, it comes with effects you need to know about before you start taking it. I'm going to reveal the 6 most common side effects of Tadalafil, how to identify them, when they're normal, and most importantly, when they signal danger. And stay until the end, because I'll share a crucial side effect that affects your vision and could indicate a medical emergency. But before we dive in, like this video if you care about your health, subscribe to the channel, and turn on notifications so you never miss life-changing health information. Let's get started. Headaches top the list as the most frequent side effect of Tadalafil, affecting up to 32% of users, according to clinical studies. But why does this happen? When Tadalafil inhibits the PDE5 enzyme to improve blood flow to the penis, it also affects blood vessels throughout your body, including those in your brain. This sudden dilation of blood vessels can trigger what we call a vascular headache. The good news? These headaches are typically mild to moderate and tend to decrease over time as your body adjusts to the medication. They usually appear within the first 2 to 4 hours after taking Tadalafil and can last anywhere from a few hours to a full day. What can you do about it? Stay well hydrated, avoid alcohol, and consider taking an over-the-counter pain reliever like acetaminophen or ibuprofen. But here's a critical warning. Never combine Tadalafil with migraine medications containing ergotamine, as this can cause dangerous blood pressure fluctuations. If headaches become severe or persistent, don't ignore them. Talk to your doctor about adjusting your dosage. Now imagine taking Tadalafil and suddenly feeling your face heat up and turn red. This happens to approximately 19% of users, and it's called facial flushing. This effect occurs through the same mechanism as headaches. Tadalafil causes blood vessels to dilate, increasing blood flow not just where you need it, but throughout your body, including the tiny blood vessels in your face and neck. Facial flushing typically appears 30 minutes to 2 hours after taking the medication and can last several hours. While it's not dangerous, it can be embarrassing and uncomfortable. Some men describe it as feeling like a sudden hot flash or mild sunburn. Here's what helps. Avoid hot beverages, spicy foods, and alcohol when taking Tadalafil, as these can intensify flushing. Stay in a cool environment and wear breathable clothing. The redness will fade naturally as the medication's peak effects wear off. But pay attention. If flushing is accompanied by difficulty breathing, chest pain, or severe dizziness, seek medical help immediately, as these could indicate an allergic reaction. Here's a side effect that catches many men off guard: nasal congestion. Studies show that approximately 10 to 11% of Tadalafil users experience this uncomfortable stuffiness. Why does a medication for erectile dysfunction affect your nose? The blood vessels in your nasal passages are incredibly sensitive to the vasodilation effects of Tadalafil. When these vessels expand, the tissues in your nose swell, creating that congested feeling, similar to having a mild cold. This side effect is usually mild and temporary, appearing shortly after taking the medication and lasting anywhere from a few hours to the full duration of the drug's effect, which can be up to 36 hours with Tadalafil. Practical solutions. Use a saline nasal spray to keep passages moisturized, sleep with your head slightly elevated, and consider using a humidifier in your bedroom. Avoid decongestants containing pseudoephedrine or phenylephrine without consulting your doctor, as these can interact with Tadalafil and affect blood pressure. The congestion should resolve on its own. If it becomes severe or is accompanied by facial pain or fever, consult your healthcare provider to rule out other conditions. Approximately 12% of men taking Tadalafil report digestive issues ranging from mild heartburn to uncomfortable indigestion. Tadalafil can relax the lower esophageal sphincter, the muscular valve that prevents stomach acid from flowing back into your esophagus. When this valve relaxes, you may experience acid reflux, heartburn, or a general feeling of digestive discomfort. These symptoms typically appear 1 to 3 hours after taking the medication and can include burning sensation in the chest, bloating, nausea, or stomach discomfort. How to minimize this effect? Take Tadalafil on an empty stomach or with a light meal. Avoid greasy or spicy foods. Don't lie down immediately after taking it, and consider taking an antacid if needed. Eating smaller portions and avoiding late-night meals can also help. Important note: if you experience severe abdominal pain, persistent vomiting, or black stools, contact your doctor immediately, as these could indicate a more serious gastrointestinal issue unrelated to Tadalafil. Here's something unique about Tadalafil compared to other ED medications. Back pain and muscle aches affect approximately 6 to 12% of users, and this side effect is more common with Tadalafil than with sildenafil. Scientists believe this occurs because Tadalafil also affects PDE11, an enzyme found in skeletal muscle tissue. This dual action can lead to muscle discomfort, particularly in the lower back, shoulders, arms, and legs. The pain typically develops 12 to 24 hours after taking the medication and can last up to 48 hours. The discomfort ranges from mild achiness to moderate pain, similar to what you might feel after an intense workout. For most men, this side effect decreases with continued use as the body adapts. Relief strategies: apply warm compresses to affected areas, take over-the-counter pain relievers like ibuprofen, engage in gentle stretching exercises, stay hydrated, and maintain good posture. Light physical activity can actually help alleviate the discomfort. If muscle pain becomes severe, persistent, or is accompanied by weakness or dark urine, seek medical attention immediately, as this could indicate a rare but serious condition called rhabdomyolysis. Now we reach the side effect I mentioned at the beginning, the one you absolutely must know about: vision changes. While relatively rare, affecting less than 2% of users, visual disturbances from Tadalafil can be alarming and potentially serious. These changes occur because Tadalafil has a slight effect on PDE6, an enzyme found in the retina of your eye. Common visual side effects include a blue tinge to vision, increased sensitivity to light, blurred vision, or difficulty distinguishing between blue and green colors. These effects are usually temporary and mild, lasting only while the medication is in your system. However, here's the critical warning: if you experience sudden vision loss in one or both eyes, this could indicate a rare but serious condition called non-arteritic anterior ischemic optic neuropathy, or NAION. This is a medical emergency requiring immediate attention. NAION symptoms include sudden, painless vision loss that may be partial or complete. If this happens, stop taking Tadalafil immediately and seek emergency medical care. Risk factors for NAION include being over 50, having high blood pressure, diabetes, high cholesterol, heart disease, or a history of smoking. If you have any of these conditions, discuss them thoroughly with your doctor before starting Tadalafil. Let's recap what we've covered today. The 6 most common side effects of Tadalafil are headaches, facial flushing, nasal congestion, indigestion, back pain and muscle aches, and vision changes. Here are your key takeaways. First, most side effects are mild and temporary, decreasing as your body adjusts to the medication. Second, stay hydrated. Avoid alcohol and heavy meals, and never combine Tadalafil with nitrates or certain other medications. Third, communicate openly with your doctor about any side effects you experience. Dosage adjustments can often resolve issues. Fourth, seek immediate medical attention if you experience sudden vision loss, chest pain, difficulty breathing, or an erection lasting more than 4 hours. Remember, Tadalafil is generally safe and effective when used correctly under medical supervision. The benefits for most men far outweigh the potential side effects, but being informed empowers you to use this medication safely and confidently. Your health is your most valuable asset. Don't let embarrassment prevent you from discussing these issues with your healthcare provider. If you found this video helpful, give it a like, subscribe to the channel, and click the bell icon for more evidence-based health information. And if you want to learn more about erectile dysfunction, watch this recommended video about natural ways to improve erectile function that complements medical treatment. Take care of your health, and I'll see you in the next video.